Specific language impairment is a term used to describe children with persistent and quite severe language problems with no apparent problem in any other kind of developmental domains. From an epidemiologic study conducted by Tomlin et al., there is an estimated overall prevalent rate of 7.4% in monolingual English-speaking kindergarten children who are diagnosed with specific language impairment. Anwar, 7 years old, is attending government primary school receiving mainstream education. He is a special child that is different from his peers.
Ayat panjang-panjang tak boleh. Tapi dia ni besar normal je. 7 bulan dah boleh duduk. 1 tahun jalan macam biasa lah. Tapi sekarang darjah 1, 3-4 patah perkataan je dia cakap. Tu yang saya risau tu. Tapi keluarga saya dengan keluarga bapa dia tak ada pun yang ada yang lambat bercakap ni.
Anwar's vision is normal with the aid of glasses for short-sightedness and astigmatism. He has normal bilateral hearing. He has been assessed by a psychologist with the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. Diagnosis show that he is non-autistic and has below average working memory. He is unable to tell a story by using various types of sentences and has difficult narrating a story or event.
To date, there is no specific or definite causes to specific language impairment. However, studies were carried out on human nervous system to rule out possible cause of specific language impairment. Almond and Pierpont 2005 provide comprehensive review of study of neurological functioning related to specific language impairment. Study that examined frontal region have reported frontal abnormalities, in particular for Broca's area, which is an important region for speech motor planning. There are also studies that have examined the basal ganglia in developmental language impairment, reported abnormalities of these structures. In terms of communication skills, specific language impairment has been associated with difficulties in mastering the medium of communication, which includes grammar, vocabulary, and phonology. Besides, comprehension of children with specific language impairment is often impaired. Some children with specific language impairment appears to have difficulties with the pragmatic aspect of communication. A study by Bishop et al. 2000 found that children with specific language impairment use less of nonverbal response than normal developing children during conversation with adults, and this cannot be regarded as communicative immaturity because young language match control children make the highest use of nonverbal response.
Substantial deficit in working memory have been reported for children with SLI. They are more prone to performing poorer in word recall in listening span tasks that requiring mental recording prior to recall, and identifications of colours prior to recall. Research also found that SLI group perform poorer in sentence encoding and recognitions of final words. In an fMRI study, these children exhibited significant hypoactivation during encoding in regions implicated in attention, memory, and language processing. As a result, educational achievement will be impaired in a children with SLI, and in return, causing psychological impact on the individual with SLI.
Language difficulty often become more pronounced with age. Therefore, affected children fall further behind their typically developing peers as language demand increase during the school years. They are also more susceptible to literacy problems and difficulty with broader academic abilities such as mathematical skill. As we know that language is important for social interaction as well as a mean to control one's emotion and behavior, children with language impairments always experience behavioral problems because language difficulty may lead to frustration and anger, resulting in increased problems with social behavior and fewer opportunities to interact with peers. As evident, parents often perceive SLD children as hard to manage. They may also face difficulty in establishing peer relationships. Children with language impairment often become targets of bullying during the school.
A study was conducted by Whitehouse et al. In 2009 regarding psychosocial outcomes in adulthood of children diagnosed with SLI. The study has shown that individuals with SLI did not perform well academically, but most had gained some form of vocational qualification and some faced difficulties in achieving consistent employment. Majority of the employed individuals work predominantly in professions that did not demand high language and literacy level. Establishing and maintaining friendships and romantic relationships are challenging for a minority group of individuals with SLI. Vast majority of SLI individuals who participated the research portrayed independent behaviors. However, there are also longer-term studies that found individuals with persisting language impairments often do not attain independent living and are more likely than those without language difficulties to be the recipients of welfare benefits.